My name is Jeff Dressander. I'm an orthopedic surgeon and enjoy orthopedics because it allows me to treat bones and joints for patients of all ages. A common reason for patients to come to see us is for injuries to what we call the rotator cuff. So the rotator cuff surrounds the shoulder joint, provides stability and movement in many directions for the shoulder. There are several main ways somebody can have a problem with the rotator cuff. The first is an injury, like a fall or a sports injury, which results in a traumatic tearing of the rotator cuff. So another way people can injure their cuff is from use and abuse over time. Commonly seen in people who do a lot of repetitive activities with their arms, such as working in a factory setting, working overhead a lot, is a very common story I hear when people are coming in complaining of shoulder pain. The most common complaint I hear from somebody with a rotator cuff problem is pain. Pain could be occurring at night that interrupts their sleep, pain with activities such as lifting or reaching overhead, and just pain with resting and sitting doing nothing at all can be painful sometimes. First, we try to get a story from the patient that gives us a clue to maybe how their shoulder was positioned when they were injured. If they can't point to a specific injury, I ask them about the activities they do at work and for recreation, because that can often provide clues to what's been causing their pain as well. Surgery is always the last resort for these issues. Things we try to get people back to doing what they need to do for work and other things. Number one is medication. That can be taken by mouth. We can also inject medicine around the rotator cuff, which can help lower their pain, followed by some physical therapy, rehabilitation to help maintain muscle strength and flexibility. When is surgery needed for rotator cuff injury? If there's been a single traumatic injury that's resulted in a very large tear of the muscle, we know that those need to be repaired quickly to preserve muscle function. However, if it's a situation that's been building up over time, the patient usually tells me when it's time to have surgery, meaning that the pain has reached a level that's really interfering with what they like to do day to day, and they just can't put up with it anymore. For patients who go on to need surgery for the rotator cuff injuries, we're able to fix almost all of them arthroscopically or with a minimally invasive approach, meaning we just make small poke holes around the shoulder, use a small camera and other small tools to reattach the muscle back to the bone where it tore from. This allows patients a quicker recovery, less scarring, and we're able to get them back to doing the things they want to do quicker. Recovery from a rotator cuff repair can take several months. The first phase of that is getting patients' motion back in the shoulder, and then a gradual strengthening program that can take up to 6 months in most patients. Good thing is the pain relief is realized sooner than the total recovery time, but that's the biggest advantage of rotator cuff repair is pain reduction that they experience, usually within the first 2 to 3 weeks after the operation. The therapy is as important as the actual surgery itself because without it, people won't regain the normal motion of the joint. They won't have the strength that they need. And after undergoing a big operation like that, not putting the time with the rehab can mean you're not going to have as good a result afterwards. At Brookings, we have access to the latest equipment, the latest techniques to help people get back to using their shoulders like they want to.